Mourners gathered at a small church in Burford, Ontario, that's in the southwestern part of the province, to pay respects to Juan Lopez Chaparro, a father of 4 from Mexico, the third migrant worker in this country to die of COVID-19. Hundreds upon hundreds of other migrant workers have tested positive. We want to focus on that this morning.
We want to get to the underlying issues that have existed for decades now.
You can test as many workers as you want to test, but it's not going to stop the virus from spreading like wildfire when they live like 10 to 20 men to one house.
These protesters on the streets of Leamington, Ontario yesterday calling for better protections for the migrant workers. They account for almost all of the 98 new cases in Windsor, Essex County yesterday. Of 98, they're 96, and all of those from one agri-food operation. These demonstrators say the virus is bringing to light issues that have affected migrant workers for years. We're going to deal with some of those issues and the particulars of what we're seeing in the Windsor, Essex area. Syed Hussan is the executive director of the Migrant Workers Alliance for Change. He's a member as well of the Migrant Rights Network, which is a national organization that supports local actions like the ones we saw yesterday. He supports that, didn't organize it, but supports it, and he's in Toronto. And Mr. Syed, very nice to have you on the program today.
Thank you for having me.
Talking about the specifics, we had the third death of a worker memorialized last night, but the number that came out yesterday, 96 of 98 cases, one agri-food operation, most of them foreign nationals. I mean, what does that reflect? What does that big number tell you?
I mean, for over 3 months, migrants and their allies have been raising these warnings, saying the housing and living conditions are such that if one person gets sick, as was said with the person prior, it spreads like wildfire. We have seen that migrant workers for the last 3 months have been saying, we know that our housing and working conditions will make us sick, they will kill us, but we are not able to speak up because we don't have permanent resident status. And so we see time and again the same story being told over and over, while governments have done almost nothing to ensure that these deaths stop. So there's a lot of solemn words that were said at Juan Lopez Chaparro's memorial yesterday, but there hasn't been permanent resident status for migrants, which is essential to save lives.
So that is one of the things that you're calling for. There are a lot of specifics and then, of course, the broader issues. Can we talk about, around this Windsor-Essex situation? I understand the reporting is that there'll be local public health officials at that one particular site for an in-person assessment. I don't know if you have any particular detail about that, but maybe you could talk about how local public health authorities are now becoming more involved.
So the issue is that local public health officials are joined by federal and provincial agencies to finally be able to go into work sites where there has been an outbreak. But they're not actually issuing stop work orders. They're not issuing guaranteed income to the workers who are sick. They don't have the ability to study that situation and say, okay, here's a pattern of abuse and exploitation, and then tell that employer and then all other employers to not repeat it. Right? So it's not an inspections regime. They're going, they're checking things out, but still there isn't the very basic powers to actually support them. But you see, the purpose of laws is to uphold existing regimes, and the current laws are bad, so the inspections aren't really adding to the structure. We need new laws. Specifically, we need permanent resident status, because all the other things are add-ons, but they don't work without the ability of the individual worker to speak up, to protect themselves. At the end of it, it's about you and I, we protect ourselves every day. We wear a mask, we decide where to go or not. Workers don't have that power, so they keep being trapped in situations where everyone's getting sick and they have to keep working.
So we had the situation in Ontario last week where the Ford government brought in new guidelines, which have raised eyebrows in some circles, and some are scrutinizing it further now because, as I understand them, and you can correct me, workers who test positive but are asymptomatic are allowed to keep working as long as they maintain physical distancing. And now some are suggesting that doesn't make a lot of sense. Where do you fall on these guidelines?
It's a death sentence. The Ford government has responded to 3 deaths by pushing workers into a situation that will make them sicker, more will get infected, and more will die. It is not possible to have physical distancing at work sites or at housing, because if they did, we wouldn't be in the situation where we are. It is not possible for workers to assert their rights. And now this is giving more power to employers who would then become the assessors of how sick you are before making you forcing you to work, which they have already been doing. This is just a green light, a signal from the top, and it shows that the provincial government is unwilling, unable to take the side of migrants, and instead is taking the side of big businesses. This is why we're calling the federal government to step in and give these workers permanent resident status so that they can walk away and save their lives and save themselves.
Well, you're right. The criticism has been that it very much favored the economic output of these farms. And so, I mean, even people like Canada's top public health officer, Dr. Theresa Tam, scrutinizing this and perhaps discussing this further with provincial authorities. Can we look at some of the specific things that are being done, though? We're hearing from the mayor of the Leamington area that testing has ramped up significantly, ramping up quickly and on a bigger scale with these mobile units arriving on the farms. I mean, are you satisfied by the response for the testing of the workers, that it's improving?
What happens after the testing? Workers who are COVID positive have already been forced to work where they were not working. In every situation where testing is happening, because there's chance of positive likelihoods, employers are forcing workers to work faster before they have to pull them off the line. That's why it's spreading. As testing comes, the work is being intensified, particularly because there are fewer workers in the country. We have members working 63-hour weeks, 7 days a week. And the other problem is that workers are being locked into these houses, so they can't actually leave. They can't send money to their families' home. They can't get groceries. People are being targeted threatened by police. They're being threatened with security guards so that they don't have to leave. So all of this texting is actually when not accompanied by giving workers their power, which is permanent resident status, means that the workers are actually trapped. And as we know, even if you're tested positive, the law says you can keep working. So none of this is actually helping migrants.
So the other thing that we're hearing from the mayor is what they're calling an isolation housing plan for the workers and their cohorts who test positive. So they would have a specific region, a pandemic control team from the Canadian Red Cross, and we expect an announcement on that, according to a tweet from the mayor, again, Hilda McDonald, within the coming days. Is that something that could make a difference if you are able to take workers who are positive away from the other vast majority?
Would we do these with the long-term care home people? Would we have just grabbed all of them and put them into a separate space and not try to change anything else? Right? We keep approaching migrants as if they need to be contained and surveilled and limited, rather than actually saying, how can we give these people rights? How will they be able to send money to their families' home if they're put into containment, which is what's happening to a lot of people as they're getting sick. The whole point is for their families back home are starving. How are they going to get groceries? How are they going to maintain social ties? Nothing is being done to ensure that workers can take care of themselves or protect themselves, and that's something the federal government needs to step in. It's great that the provincial and the local authorities are doing the best they can, but the buck stops at Prime Minister Trudeau's office. He said that Canada needs to do better. He's promised overhaul. The first step needs to be permanent resident status for all migrants, not just these farm workers, but undocumented people, care workers, because we're seeing, while we're focusing on this, it is the same type of tragedy, the same type of illnesses and disease and death that is affecting all non-permanent residents because they cannot they want to protect themselves, but they're unable to do so because of the laws that tie them down.
Okay, so let me just ask you in conclusion, earlier this month, Ottawa did promise to overhaul the program. Do you have talks scheduled? Are you optimistic of concrete discussions? Because obviously your answers keep coming back to the reforms that you want. Is there anything on the agenda for you?
We've spoken with the Minister of, I've personally spoken to the Minister of Immigration and the Minister of Employment earlier, mid-last week. They promised swift action and to get back to us. And we told them that there is no other solution that does not include permanent resident status. There's no fix that's just testing, just housing. It has to be about worker power. It has to be about workers' ability to walk away. This is reasonable. We need a single-tier immigration system. And we haven't heard back. We're waiting for the ministers to take the next step to actually put this into practice. And then we more continue to get sick, more will, there are people in ICU. Mm-hmm. So our concerns remain, and swift action is essential to save lives.
Syed, Hussan, thank you very much for the time today. Appreciate your being on the program.
Thank you for having me.